Hey, welcome back to the Big Ranch Show. Thanks for joining me. Now, today we're going to talk about cancer treatments, insulin, and a number of other things that our government should be paying for. But let me make this very clear. This channel will always support the idea or the notion of Medicare for all, or universal health care, as others would call it. I believe everybody should have access to the best care possible in America, regardless of their ability to pay. Just because you are poor or low income does not mean you should not be able to have the best care possible in one of the richest countries in the world. Now, over the last few weeks, there was a post on Twitter from a person named, I believe, Nina Turner, progressive, works with TYT and some other groups. And she does a lot for, you know, pushing the cause of the everyday American. And she's an awesome woman. But she was talking about how insulin should be free. And she got a lot of pushback from people saying it shouldn't be, but it should be. She's not wrong. So why would people be so upset about that? It's because here in America we have otherized people to the point that we don't care about them. We think that things like becoming diabetic is a choice because a lot of because it's tied to diet and things like that sometimes. But also, people don't realize too that sometimes weight gain has nothing to do with what you're eating. Some people are just not able to lose weight. I see it all the time when people criticize Lizzo. The woman works out, the woman eats relatively healthy, and people still hate on her for her weight. But sometimes, though, you're not diabetic because of a diet or because you're overweight. Sometimes you're born that way. And it's, you know, juvenile onset diabetes is awful. Some cases it's deadly. But you have older Americans now more than ever being diagnosed with diabetes or insulin resistance, and they need insulin later on in life. And it should be free. They shouldn't have to struggle to be able to afford it. I believe the government should cover that full stop. I know too many people that are diabetic that have had to make choices between affording rent and affording their insulin. I've known too many people that have gone without their heart medication because they needed their insulin or had to go without their insulin to cover their heart medication. This should not happen in the richest country in the world. Every year, thousands, if not millions, of Americans die of cancer. Cancer, too, at this point, that should have been cured if not for the profit motive. I believe we should take profit out of medicine, especially out of cancer treatment. Cancer treatment should not be being made because you can make a profit. Cancer treatment should be being made so people can survive, that we can cure cancer. But big pharma is more concerned with you being a patient than you being cured. Cancer treatments should be fully covered by the federal government. The prices for cancer treatments should be, you know, there should be a discussion between big pharma and the federal government on what the federal government's going to pay for said treatments. But nobody in America should be denied the best care possible and the best treatments possible and should not have to face bankruptcy and ruining their financial futures just to survive cancer. It just shouldn't be. I don't care if you're a billionaire like Elon Musk or if you're completely broke. If you get cancer, it should be covered. There should be no questions asked. There should be no, you know, the government gets to decide your treatment. No. You should be able to go to whatever doctor you want to go to that will treat your cancer. That doctor should get to, you and your doctor should be able to sit down and discuss what the options are and what the best route is for you. And then the federal government should just cover it. I believe healthcare is a human right. I believe healthcare should be covered for every American, period. I believe if you were born on this soil or you have immigrated to this soil and you are a legal resident of this country, no healthcare should be denied to you. If you need insulin, it should be covered. If you need cancer treatment, it should be covered. If you have HIV, you have any other severe ailment, it should be covered in the richest country in the world. We've got to do more to elect people that will fight for these causes, that will fight for universal health care, that will fight to make cancer treatments free, to make insulin free. Period. And here's the thing. Some people will sit there and say, well, some places offer insulin for as low as like $20 a prescription. That's great. But not every type of insulin is perfect for every single diabetic. Not everybody's system is exactly the same. So some that work for some may not work for others. Some cancer treatments that work for some may not work for others. As well, I believe that if a person has exceeded all normal options for cancer treatment, they should have the right, regardless of if the FDA has approved it, to take on experimental treatments. I read about a guy the other day who was dying of a cancer of the tongue, whose only option would be a vaccine for his particular type of cancer that's been approved in other parts of the world but isn't approved here. So he can't have it. So he's just going to die in the next 3 months. This should not happen. When somebody is dying of a disease, there should be no government entity that can block them from the care they need. If the doctor says this is the best option and the patient agrees, then that's what should happen. The government should not stand in the way of that. Like back during COVID, right? It was shown that ivermectin really wasn't all that helpful, but there were a lot of doctors that were prescribing it because they felt that it could at least help a little bit, that it couldn't hurt that much. That it wouldn't hurt as long as they were being given human doses. And I didn't want to stand between doctors and their patients. As much as we knew that ivermectin wasn't really much of a help, some doctors felt that they had to do something for their patients. So I completely understand where they're coming from. And I still believe the government should not come between you and your doctor. I believe cancer patients Should have all the treatments necessary. Insulin, people that need insulin should get their insulin paid for, and every other ailment that you could possibly imagine that could possibly bankrupt a family should be covered. Honestly, I think you should just be able to go to the doctor. I see other parts of the world all the time, like Germany, people that have moved there from America and become citizens over there. And I saw one person, they broke their arm, and they thought, "Oh my God, how am I going to cover this?" But they were in Germany, and the and it was just paid for. It was just covered. I've read about about a woman who was having really major problems, with her like I believe it's like it came up with some kind of polyps or something in her reproductive tract, whatever it was cancerous, and she didn't know what to do. She was like, one of her friends told her to go to the doctor, right? Because she knew about this thing and it got worse, and they told her to go to the doctor. She's like, I can't afford it. And her friend, there again, the people from Germany were like, hey, you don't have to worry about that. Just go to the doctor. It's covered. And I've read this time and again from different people who used to live in America that now live in Germany. They don't live like this. They don't live in fear of going to the doctor. They don't live in fear of these things because it's covered. They don't live in fear of going bankrupt because of one medical emergency. Last summer, I was in the hospital for 3 days. Well, 3.5 days. And it was $22,000 of money I didn't have. Money I still don't have. But the only way I'm going to be able to get that off of my record is to file for bankruptcy. And I believe they deserve the money. They treated me so well. But I can't pay that. Somebody gets in a major car wreck, that's hundreds of thousands of dollars. Especially if you're in the hospital for, weeks, hundreds of thousands of dollars. People can't afford that. Somebody has a child that comes down with leukemia. They shouldn't have to pay for that, even if they can't get to St. Jude. There are great places like St. Jude's that treat children with cancer, and that's awesome. But low income people don't always have the option to travel that far if they don't have a St. Jude type hospital in their area. And adults, if they have cancer, what do? Did you know in a lot of situations, cancer treatment is based on how much you can pay? There's a wrestler. You probably know him as Roman Reigns. He had leukemia. Because he had money and money backing him, he was when his leukemia relapsed, he was able to fix it. He was able to take care of himself. Around that same time, though, that he got that his cancer returned, that his leukemia returned, I read on the internet about another person whose leukemia returned, the same type of leukemia, but they couldn't afford the treatment, and they died because they were more worried about whether or not they were going to have to pay extra money or pay money that they couldn't afford, and they didn't want to be a burden. Does that sound like the America you know? or the America you want to live in? Let me know in the comments what you think about free insulin and free cancer treatments and what you think about universal health care. Thank you for watching.